and I'm a lecturer in education, and I'm here today to talk about some research that I've done using SAIL data. The project I'm looking at and have researched on for the last 2.5 years roughly is looking at care experienced children's educational outcomes using population level data with other authors at Swansea University, Cardiff University and Bristol University who are based in data science, education and social care. So care experienced young people are a marginalised group in society and they do face significant social exclusion. One of the areas where unfortunately they aren't able to reach their potential is educational outcomes, particularly around attainment and grades, for example. This research wanted to understand care experienced young people's educational outcomes, so children who have experienced foster care, kinship care, or were adopted or living with other parents, for example. We wanted to look at how their movements in care shaped their educational outcomes at age 7, 11, and then for their GCSEs at age 16. What makes this research novel is the aspect that we weren't just looking at different types of care and their relationship with educational attainment, but we were trying to splice up how different children had different care experiences and different histories and how that directly related to educational attainment. So going beyond binary understandings, so in care or not in care, or short-term versus long-term, or foster care versus kinship care, for example, we were looking at all of those things to understand how can we find groups of children that have had similar experiences, so for example, short-term foster care early on in life, and how that relates to educational attainment. Why this research is so important is because the Welsh Government are doing an enormous amount of intervention now on care experienced young people. For example, the new basic income that's not long came in for care leavers. And we know that they're a really important part of society that have majority been overlooked and need support and intervention to reach their potential. This research feeds into that by looking at over 16 years of data, which is pretty hard to come by, generally speaking, in terms of data linkage and population level data, to look at the longitudinal impacts on educational attainment and what possible interventions there could be for young people in this space. Particularly, we're interested in whether suspensions or exclusions negatively impact the relationship between an individual's care experience and their educational attainment. So we're looking to provide some insights on what schools or social care could actually do to improve the lives of young people. So the main goal of this project was to use population level administrative data from a variety of sources. So we've got our social care data, our education data, and also our demographic data largely, which we were looking to link and to formulate kind of an electronic cohort of children born between 2000 and 2003 and follow them over 16 years to identify the patterns of care they'd experienced, their educational attainment, and any kind of secondary school experiences that they've had that may explain the relationship between their care history over 10 years and their educational attainment. What we wanted to do also was to improve data linkage between these groups. So Dr. Alex Lee, Dr. Grace Bailey and Dr. Stuart Bedston had a really important role on this project of boosting the amount of data that was available on care experienced children. And without that, we would be completely unable to do this study because some of the data earlier on in the 2000s is quite sparse for care experienced children. So one of the goals of the study also was to implement this boosting technique, get a larger sample and the ability to follow 3 cohorts of children over 16 years to look at their educational attainment and their experiences adjusted for key demographic characteristics which can also impact educational attainment. So we linked from a variety of sources, as I've mentioned, so education, social care and demographic data, health data also, to look at all of the different aspects of our study. So we use social care data to look at how children moved in and out of care, their placements they've had and the duration of time they spent being in care. We also use the education data to look at aspects such as free school meals, special educational needs, now additional learning needs, key stage outcomes, so at age 7, 11 and their GCSE outcomes, and suspensions and exclusions. We use education data in lots of different ways. And then we also use health data for mental health aspects, birth characteristics, so birth weight, the length of gestation, all of those aspects. And we also use demographic data for things like sex, ethnic group, and also deprivation level. Yeah, so I think this was one of the most important parts of the research, and I think it's where I probably definitely learnt the most out of researchers involving people who are affected by the research and the research, and I truly saw the value of that throughout this research. So we had quite a few different aspects of that. So we included, I would say most importantly, care experienced young people from CASCADE VOICES. We included them at 2 points. So in the initial part of the research, shaping our ideas, what aspects of school are important for care experienced young people, what do they feel or in their opinion was important for educational attainment that we had access to, so balancing what's available also with kind of what they feel was important in their opinions and perspectives. And then we also spoke to them and worked with them regarding how we disseminate the data and how we disseminate the findings and what they thought of the findings. And what was really interesting is they talked a lot about stigma, the stigma of having lower educational outcomes. Care experienced children for the most part have already been through quite a lot in their lives already, and it adds to that additional kind of negative rhetoric which they feel surrounds them. So we've tried really hard to kind of think about this document and think about the findings in a very supportive way, and to think about the mechanisms that we can move towards kind of support strategies or intervention strategies, and not just stop at this point of care experienced young people do kind of poorly in educational attainment overall in a general way. We will need to think, what can we actually do to support these children? So I'm working with local authorities, schools and also virtual heads at the moment, trying to develop some guidance to improve potential support strategies and interventions for young people who are care experienced to ensure they reach their potential. Yeah, so if we think about just early childhood, so age 7, Key Stage 1 outcomes, we can see adopted children are meeting the national kind of expectations, or around in line with the national population. 80% of those in the national population are reaching Key Stage 1, and adopted children are around that benchmark, which is great. We can see kinship care children, or children who've been in kinship care, around 65% of them on average are meeting Key Stage 1 expectations, but we are starting to see differences for those who've been in foster care or have had mixed placements, and we can see that around 40 to 50% of them, and sometimes up to 60% of them, depending on the time they came into care, are reaching Key Stage 1 outcomes. So we're starting to see already that kind of difference emerging, but it is higher compared to adolescents, for example. So in adolescents, even those are adopted who are not meeting Key Stage 2 kind of benchmark. So 60% of adopted children on average are meeting those outcomes later on in life. So we can start to see essentially this gap emerging as children spend time in education who are care experienced. And of course, in that sample, we're including those children who come into care later, which we know is a known risk factor for lower educational outcomes. So we're starting to see this widening effect over time, where children who are care experienced who come into the care system later are having lower educational outcomes, particularly for foster care children who have come into care around age 8, which seems to be a particular risk factor for educational outcomes at the end of primary school. Now, in terms of our last analysis, we were primarily interested in what we call mechanisms. So what explains the relationship between the different groups that we found in our relationship who were care experienced and their educational attainment at age 16, so GCSEs, which we know are important for educational opportunities to move on to A levels or university or apprenticeships or any foundational degrees which are important for young people, even just education and training. A lot of GCSEs are required even for kind of quite technical roles now. So all of these things are really important. We were interested if certain parts of the school experience could explain that relationship. And what we found was that free school meals being suspended or excluded or moving around in schools were particular risk factors for children who had come into care quite briefly and then were reunified with their parents later on. So essentially what's happening is that those children go back to their parents, they're only in care for a relatively short stint. However, we're starting to see they're having a lower experience in secondary school, so being excluded, suspended, having free school meals, or moving around schools a lot, which is directly relating to their lower educational attainment for GCSEs later on. So we're starting to see that these aspects for a potentially hidden group of care experienced young people are at risk of a poorer school experience, which may lead to lower educational outcomes later on. Yeah, so I think this research is really important. So it builds on the existing evidence base already that our care experienced young people in society are not reaching their potential in educational attainment. But what we also can see a bit more from this is the differences in educational attainment in early childhood and at the end of primary school, depending on the care experience they've had. So it really adds to that body of literature and brings something novel to that sphere of, how does kinship care differ to foster care? We bring in placement type, age of coming in, duration of care, which no other study to our knowledge has done yet. So I think that raises some important challenges of different care placements and educational outcomes that needs to be considered by policymakers, local authorities, schools, etc. Yes, but I think one of the most novel parts of our research is identifying that children who were reunified with their families, who previously went into care for a very short period, are having a negative school experience, which is impacting their GCSE attainment. And I think that research extends our understanding further, because now we can start to quantify the actual impact of school experiences on attainment. And it could be really important for what we call this hidden group of children. So children who go into care, come back out, who may, by the time it comes around to secondary school, not be recognised fully that they are or were in care or in need at some point. So I think that research is particularly novel about that and raises some important challenges on how do we support all different types of care experienced children. It also builds on some of Dr. Sarah Long's and mine and all of the big collaboration that was involved in that research, looking at children in need or children on the protection register who are again at higher risk of lower educational outcomes, even comparing to care experienced children. So there is quite a large group of care experienced or children in need group that really do need support and intervention, which are potentially kind of not being picked up by the relevant authorities and schools, which need better support and intervention to reach their potential. Yeah, so I think Welsh Government needs to keep doing what they're doing, so keep improving support, keep improving intervention. Things like basic incomes were really welcome, recognising care leavers, particularly at university level, was really welcome. And I think, a lot of good work's already happening, but there's still more to be done. So in terms of, how do we transfer communications between schools? How do we know children's experiences when they move between schools? Communication between schools on experiences is really important. How do we better identify key risk factors? So some of this research feeds into that. Things like suspension, exclusion, school moves, things like special educational needs, free school meals. Knowing more about the context of that in research is really important, so we can feed into that and understand how those things can impact children, or how they can provide support mechanisms as well for different types of children. So I think when we need to go next is think more about kind of tailored approaches, potentially, around different types of care experiences, different experiences, and the specific support they need, which some of this research already taps in. And we also need to support them groups who are kind of not necessarily identified immediately by social services, education, those, like I said, who have maybe gone into care briefly and come back out. How do we put the support in place for those? So are there hidden groups of children that aren't being identified and given the right intervention and support that they need is probably the best place where I think this research needs to go. And I'm currently looking at how I can work with local authorities, schools and virtual heads to create some kind of research-led knowledge exchange guidance for schools and best practice. So what are good school practices doing right now, and how can other schools adopt them, and creating that in a kind of way that's friendly for teachers, practitioners and virtual heads to help inform their practice where we can. And just a plug that we do have a stakeholder report, which is written for kind of anyone interested in this area but who works in this area, on all of our findings in a really nice format, and I think a very kind of accessible format. Os chi yn siarad Cymraeg, dyn ni cael adroddiad yn Cymraeg hefyd. Gallwch chi dathlen amdano prosiect ymchwil yn Cymraeg ar y adroddiad.